Welcome to Module 14. In this module, we're going to go over a complicated case with a 27-year-old male patient who has chronic bouts of fatigue, depression, anxiety. He has fatigue 90% of the time. He was diagnosed with ADHD during his adolescence and then had some somatic brain injuries and Hashimoto's. And he's really stuck. He's done a very good job of becoming educated in functional medicine for his own health, and probably better than most practitioners. But he needs some help to figure out how to get to the next level. The clinical expert topic interview is with my good friend Andrew Campbell. Andrew Campbell is a medical physician. He really has an expertise in mold, and he's published many papers on mold toxicity and written many chapters on mold toxicity. And we have this discussion about how to look at mold antibodies and mycotoxins and the relationship between mold and chronic disease and autoimmunity. So I hope you enjoyed that. The practice lifestyle interview is with my good friend Josh Reed. He's a chiropractor, also has an MS in nutrition and a Master of Public Health, and is completing his ND degree. So he's a very dynamic guy. And he has 7 successful functional medicine practices in Utah with lots of associates. So we have a good discussion and talk about how he manages associates, how his practice is working with being such high patient load and high patient and high staff to help his practice run, and also what kind of marketing he does and what things have really worked for him. Physical examination skill will be how to evaluate visual tracking of the eyes. Visual tracking of the eyes can tell you a lot of information about what's happening with the person's physiology. We're going to get into the laboratory interpretation of clinical pearl, which will be ominous markers. There are several ominous markers that you should be aware of that show up on routine blood tests, like a sudden drop of cholesterol or spike in lymphocytes. The more ominous patterns you see together, the more concerned you are for underlying serious pathology, most likely malignancy. And these things pop up all the time, and you should be able to spot those out pretty quickly. And then as far as the clinical management, clinical pearl for this module, we're going to go over the concept of when do you call it quits? So when a patient is not responding to care, how do you deal with that? What kind of discussion do you have with the patient? What are the variables you should be thinking about, and how to address that clinical scenario? And then the bonus video, I just made a video on discussing how important it is to change your schedule to accommodate your life instead of your life around your schedule at your office. And there's some balance between those concepts, so we'll be going over that. Hope you enjoy the module. Thank you for being part of the program.